President Donald Trump's latest healthcare executive order, while pitched as a move to cut costs and increase access, ultimately grants a significant victory to the pharmaceutical industry, one that could reverberate negatively through the American healthcare system for years. Framed as part of an effort to revamp how Medicare negotiates drug prices, the order effectively aligns the policy with Big Pharma's long-standing wish list. Rather than accelerating relief for millions of seniors struggling with the cost of prescriptions, it threatens to stall progress, preserve inflated profit margins for drug makers, and further erode public trust in a system already viewed as rigged against patients. At the heart of the order is a push to extend the timeline before which certain prescription drugs become eligible for Medicare price negotiations. Specifically, Trump has embraced a proposal to delay the timeline for so-called small molecule drugs, most commonly pills and capsules, from 9 years to 13. This delay would bring them in line with more complex biotech medicines, which already enjoy a 13-year exemption. But unlike biologics, small molecule drugs represent the vast majority of medications used by the public, including for conditions like high blood pressure, diabetes, and depression. The practical effect of this change is a 4-year extension of market exclusivity, allowing drug makers to continue charging high prices without government interference. In a country where over 30% of adults report skipping doses due to cost, this is not just bad optics, it's deeply harmful policy. The executive order stops short of changing the law outright, since that power lies with Congress. Instead, it directs the Department of Health and Human Services, led by Robert F. Kennedy Jr., to work with lawmakers to make the change, a maneuver designed to signal intent without triggering immediate legislative backlash. But the message is clear. The Trump administration is willing to reverse one of the key provisions of the Inflation Reduction Act, one of the most ambitious healthcare cost control measures in decades, in favor of policies more favorable to pharmaceutical giants. Supporters of the extension argue that it protects innovation, claiming that shorter timelines for negotiation would discourage investment in new drugs. But this argument often masks the real motivation: preserving monopolistic pricing strategies for as long as possible. There is little evidence to suggest that a 9-year negotiation window has deterred innovation. In fact, many blockbuster drugs generate the bulk of their revenue within the first few years after approval. Extending that timeline does not meaningfully increase scientific output. It just protects revenue streams. Meanwhile, the costs are passed down to patients, many of whom are seniors on fixed incomes who cannot afford $500 a month medications. The order also includes other measures designed to present a more patient-friendly image. It encourages states to develop drug importation programs, though the FDA has only approved Florida's application to date, and pushes for greater FDA support for generics and biosimilars. These are positive gestures in theory, but in practice they may prove to be more symbolic than substantial. Generic and biosimilar development is already plagued by legal loopholes and regulatory bottlenecks that delay entry. Without meaningful reform to patent law or FDA resources, streamlining these approvals will have limited impact. Worse, the inclusion of these more popular provisions risks camouflaging the core agenda of the executive order, extending the status quo for brand-name drugs and undercutting one of the few mechanisms available to hold prices accountable. It's also notable that this move comes just after the administration opened a national security investigation into the pharmaceutical supply chain, a potential precursor to imposing sector-specific tariffs. On one hand, the administration is claiming to champion domestic production and cost control, but on the other, it is advancing policies that lock in high prices and protect the same multinational corporations that outsource much of their production abroad. The contradiction here is stark and troubling. A tariff-driven supply strategy may raise costs further, while the rollback of Medicare price leverage will ensure that those costs remain unchallenged. What is presented as economic patriotism may end up being little more than a license for price hikes under the guise of protectionism. Even the attempt to introduce site-neutral payment reforms, designed to make costs consistent regardless of where care is delivered, brings potential risks. While it may level the pricing playing field in theory, without a broader reform of provider reimbursement systems, it could also lead to cuts for facilities that genuinely require higher reimbursements, particularly rural and community hospitals already on the brink. These moves must be accompanied by robust safeguards or risk compounding access issues in underserved areas. Taken as a whole, this executive order reveals a broader strategy that is both politically calculated and economically risky. It seeks to roll back the few hard-won consumer protections in the drug pricing space, while cloaking itself in the language of reform. The pharma lobby has long fought against Medicare negotiation, and this order, though limited in immediate scope, is a major step toward fulfilling their goals. While the Trump administration may position this as a win for free market healthcare, the reality is much darker. By seeking to delay Medicare's ability to negotiate drug prices, it's effectively prioritizing corporate margins over patient access and affordability. It's a move that offers near-term gains for shareholders but long-term consequences for public health. For the millions of Americans who believed prescription price relief was finally on the horizon, this may signal not progress, but a slow unraveling of that promise. If Congress follows through, the result could be a decade-long detour from affordability, at the expense of those who can least afford to wait.